I'm Joshua Koshki, and I'm a restorative and aesthetic dentist at Santa Monica Dental Arts, located in Santa Monica, California. A smile makeover or a full mouth rehabilitation is really about looking at the whole picture when we first have this patient come into our office. We're not just looking at it tooth by tooth, we're looking at it from multiple different angles. Typically, a full mouth rehabilitation is for patients who have multiple things going on. This could be functionally, aesthetically, it could also be both. Especially in our practice, we want to make sure that everything is working well together. The goal is to have a complement set of teeth. We don't want to just focus tooth by tooth. We want to make sure that everything is working well together. Instead of doing things piece by piece, we create a comprehensive plan that really helps restore balance and confidence. It's less about the perfect smile and more about a smile that actually fits the person and that is actually functional. When it comes to deciding if a patient needs a full smile makeover or just a single treatment, it really comes down to whether the issue is isolated or if it's a bigger pattern. If it's just one chipped tooth or a small cosmetic concern, a single treatment usually makes sense. But when we start seeing wear, bite issues, or multiple restorations failing, that's when a full smile makeover becomes the smarter long term option. When it comes to full mouth rehabilitation, it allows us to address a wide range of things like broken teeth, worn teeth, missing teeth, bite problems, even jaw disorders. A lot of these issues are connected, which is why we step back and we really look at the complete picture before starting anything. So, with a clear treatment plan, we know exactly what the end result is going to look like and what it should look like. That way, each step builds towards a smile that feels comfortable, functional, and natural to the patient. We always want to start with function and comfort because a smile has to work before it looks great. If the bite isn't stable or if the teeth aren't comfortable, the aesthetics just won't last. So once the foundation is solid, we fine tune the appearance so it looks natural and effortless. The goal is a smile that feels good and looks like it has always been theirs. So most patients, after going through a complete smile makeover, they notice a big shift in confidence immediately. Maybe in the beginning they're in shock, so they don't really notice it in the beginning. But typically, over the course of about a month or two, they really notice a big shift. They're more comfortable smiling, eating, even thinking about how do their teeth look. There's also a huge sense of relief, especially for people who've been dealing with dental issues for years. As a restorative dentist, it's really rewarding to see patients feel like they've gotten a fresh start. So when patients come to Santa Monica Dental Arts, the first step is always going to be having a conversation. I want to take the time to listen, evaluate what's exactly going on, and come up with a clear plan without rushing or overwhelming anyone. You're not going to come to the office and we're not going to strap you down to the chair and just start immediately doing treatment. The goal is to really listen and come up with a plan that works with you and allows me to achieve what your goals are. When patients come in, I try to break everything down step by step so patients know exactly what to expect. Our goal is to make the process feel manageable, but also supportive from clinical team of dentists and also the front office team, make it a much more comfortable process for the patient.